Hi, I'm Sarah Bruce and you're watching EHI TV, bringing you the industry's top 3 most read news stories this week. At number 3 this week, and the NHS Confederation has published a new report that says NP Fit has left the health service stuck in its ways. The report blames the National Programme for IT for creating scepticism about what technology can do for the health service, and says that NHS technology is similar to that of the pre-industrial handicraft industry. It echoes similar thoughts to those made by Intellect last week that say that the NHS may struggle with new technologies and that top-down initiatives have led to a lack of local engagement. Our number 2 most read news story this week comes from the latest guidance on the operating framework for the NHS, which tells PCTs to collect information on how many GP practices are enabling patients to access their records online. PCTs have been told to get information from GP IT suppliers about the number of practices in their area that can provide and allow record access to their patients. The PCTs have also been told to expect much more focus on record access in the future, but the DH says that no level of expectation has been set as of yet. And our number 1 most read news story this week comes from the controversial health bill, which puts a price tag of £1.2 billion on the NHS reforms over the next 3 years. Interestingly, a breakdown of the costs per PCT include the cost of transferring IT systems to consortia at an average of £1.89 million each. Perhaps more worryingly, it then argues that setting up a new IT system and transferring the old one will be the equivalent of only 6 months' work, putting the cost of setting up a system for a consortia at just under £1 million. Well, when EHI caught up with Shadow Health Secretary John Healey to ask him his view on the health bill, and more specifically NP Fit, he wasn't able to give too much away. It's a serious area of change that's below the radar of many, many people, he said. I guess we'll let him off since he's only been in post for 4 months. Well, that's all we've got time for this week, but I'll see you next week. So bye for now.